I'm David Kidney. I'm the Executive Chair of the proposed West Midlands Health Technologies Cluster. I was really pleased to be one of the keynote presenters at the West Midlands Innovation Alliance's excellent Zoom conference on the 30th of April. As a keynote presenter, I explained how I've been set up by the 3 West Midlands LEPs, that's the local enterprise partnerships, and other funders, to establish the West Midlands Health Technologies Cluster. And I hope the large audience found that helpful. But for me, the value was in the health and social care breakout session, which I participated in afterwards. Here we looked at some of the challenges of going from the emergency caused by COVID-19 to the recovery stage and reaping the benefits for the West Midlands region. And we identified for those health technologies businesses the importance of us to focus on supply chains, on collaboration, and on flexibilities going forward. I'm going to take a lot from that session, which I will use in my project setting up the West Midlands Health Technologies Cluster.
Hi, it's Bethan Bishop and I'm Chair of the Innovative Health Working Group, part of the Innovation Alliance for the West Midlands. And I've been given the opportunity to share and reflect some of the discussions that happened in a recent online event, very successful online event run by the Alliance. So you will have heard from some of the keynotes and some of the discussion points that they posed, reflecting on what's been happening during the pandemic. And what I wanted to do was highlight some of the responses that we had from the participants in the group. So the first and really key discussion point has got to be about collaboration. So we heard some wonderful examples of where collaboration has been strengthened. So these are existing relationships between organisations such as universities and businesses in the region and beyond, and how they've started to work in new and innovative ways. But in addition, what we're starting to see, and I've seen some of this on social media post the event, of how some really new and exciting collaborations are emerging, and it's really important that we continue to share these case studies so that other businesses realise how they can interact effectively with the sector. The other thing that we heard of in terms of a new opportunity is the way that for some businesses their supply chains have been severely disrupted. And what's been happening, a number of businesses within our region are working internationally and globally, and that also means that their supply chains sit there too. But what they're struggling to do is to source some of the materials within their supply chains. And they can't quite see how some of this will change over the coming months. So that does mean that we have an opportunity to respond to that in the region and nationally, and think about how we can plug some of those gaps and create new services and create new processes. The other thing that we've been hearing is how rapid deployment of technology has been happening across health and social care, which obviously is hugely positive, but how some of the products that are being used, some of the platforms that are being accessed, aren't quite yet there in terms of their suitability for health and social care. There's a little bit more development that might be required. And there's more stress testing that needs to happen. And obviously this is something that businesses want to be able to respond effectively to. So there's definitely more work to be done in that area. We also heard from the group how people are still a little unclear about some of the emerging opportunities with 5G. And we've definitely got some opportunity within our region, given some of the infrastructure that's being created, to be demonstrating more of what 5G can do. And so health and social care obviously really keen to be part of that. And then finally, a really important point has been the way that some procurement for innovation and some of the regulations around that appear to have been relaxed a little during the pandemic, obviously to make things happen more rapidly. And it may just be that actually some of the systems are being used more effectively. So what everybody was talking about is how we'd like to see that built upon, and how we'd like to ensure that that allows businesses to be working more effectively with the health and social care system, and how some of these new partnerships can emerge with that sort of facilitating the way. So I'm really pleased that we had a very active discussion. It feels like this is just the start of a discussion. And I know that the Innovation Alliance are going to be very proactive in taking some of these discussions forward with everybody, facilitating more discussion, facilitating more input from frontline staff that were obviously, for understandable reasons, unable to participate in the day. And I'm really looking forward to seeing what emerges.
It was really good timing for stakeholders to come together to look at the innovation policy and practice we will need for the recovery after COVID-19. And the technology worked really well for a conference of over 80 people as we debated the crucial issues of this time. The point I wanted to make during this conference was that we cannot take for granted that the changes that we have made during the COVID-19 emergency will naturally endure after COVID-19 is beaten. We have to work really hard in the West Midlands region to capture the benefits of the changes that we've made and make sure that they endure. So we are an enterprising region, the West Midlands, and I think it's time for us to put that enterprise to great use for the benefit of everyone who lives and works in the West Midlands.